Well, I have my news up here at Nsawam in Kanda. This is News 360. My name is Alfred Okansi.
And I am Aisha Yakubu. Coming up in the bulletin this evening, close to 500 handicapped persons unable to access the orthopedic training center in Nsawam due to the COVID-19 pandemic.
Also in the bulletin this evening, Insurance Commission to introduce digitized and manifest systems of issuing tickets to passengers at the country's bus terminal. But COVID continues to impact on us in many ways, and close to 500 handicapped persons could not access the orthopedic training center in Nsawam due to the COVID-19 pandemic. A center which helps persons with disability, especially children, to gain independence and productive skills, had to drastically cut down on its outreach and inpatient numbers. Wendy Laryea visited the center to assess the situation.
15, 16, 17, 18, 19, 20.
The Orthopedic Training Center, OTC, is a non-profit organization located at Nsawam in the Eastern region and has since its establishment helped persons living with disability in Ghana, mainly children, to gain independence and productive lives. The OTC, as it is known for short, was established in 1961 and caters for patients in Ghana and the West African region. Over 6,000 people a year, mainly children, are helped at the center or receive the help they need from the mobile orthopedic units. But since the onset of the coronavirus pandemic in Ghana early last year, the center had to cut down a number of its activities. From attending to 7,000 patients in 2019, the center could only attend to 5,600 patients in 2020. Inpatients at the center have also been drastically cut down to prevent the spread of COVID-19, from about 110 inpatients every 3 months to 42. This has affected healthcare delivery.
What we did was we looked at all of our patients and we made sure that they had the orthopedic appliances they needed. And so those that it was safe to send home, we sent home to their family. The children that we kept here, we kept for a few reasons. Some of them would not have a family to go to. And other children, it would not be advisable to send them in the particular part of the country where they do come from. It would have been more dangerous for them with the COVID than to be with us.
The activities, like the center's mobile orthopedic unit, which tours the country on a regular basis, providing support to those unable to visit the center, has also been cut down.
We draw too big of a crowd. And so we were not able to go at all this year to the central and western region of Ghana. We did decide to look at how can we go to the northern upper region. We normally go there for 3 weeks, but we also knew that was dangerous to do that. So our team went for 1 week, and they only went to Tamale and I think 2 other places where people could access our services.
The orthopedic clinic and workshop were set up to manufacture the orthopedic appliances needed for the physically challenged. The workshop manufactures orthopedic shoes, shoe prostheses, leg braces, artificial legs and arms, splints, among many others. Besides making new appliances, the workshop also repairs the appliances, but staff now run shifts to prevent the spread of COVID-19, and this has impacted delivery.
Before COVID, if somebody places an order, first of all, we have to let the patient come on admission. But now we have added one thing which it was not there initially. Now we have to measure, let the patient go and come for admission when it's ready. So I think it has increased by another 1 month. So making 3 months in total. Yeah, ordinarily 2 months, within 2 months.
Another major challenge for staff during this period is how to protect themselves and stay safe, since they come into contact with patients in their line of work.
If it's a limb you are dealing with, you would have to actually move that limb, touch, feel to be sure of what you are dealing with. And with the COVID, you become a bit skeptical. You are careful, extra careful, because you don't know who might be carrying the virus.
The center's Leonard Williams Cerebral Palsy Clinic and Daycare Center was also closed last year due to COVID, but now attends to only 4 children.
Because of COVID, we had a long break. We were not asked to go to the homes again, so we couldn't really follow up so well. Some to develop later complications, which will be difficult to separate the mom from the child now. So all these things happened because we had this long break due to COVID and all that. So you can see our numbers have actually reduced a little bit. At first, we used to have as much as 7 kids.
They cater for children with cerebral palsy only within Nsawam and its environs. The center hopes with the necessary support it can impact more lives even in the midst of this pandemic. Wendy Laryea, TV3 News, OTC, Nsawam, Eastern Region.